The success of public health is often measured by what you don't see. Every day, local health departments are working to improve the health security of their communities, and every vaccination clinic and disease prevention campaign improves community health. Here are 3 real-world examples of how local health departments are translating the National Health Security Strategy from paper to practice, making their communities more prepared, protected, and resilient in the face of disaster.
Okay, so now a common emergency is an emergency that happens somewhere every day. Every day, common emergencies happen. They don't happen to you every day, but they happen to someone somewhere every day.
The 2009 Macomb County Behavioral Risk Factor Survey showed that only 25% of adults in Macomb County believed that their households were well prepared to handle a large-scale emergency or disaster. And a survey of 5th grade teachers in Macomb County showed that emergency preparedness really wasn't taking place in classrooms, and that most students were only somewhat prepared to handle some emergencies. So we decided to create a program that would focus on educating youth about emergency preparedness.
For medical emergencies, there's not much you can do other than to learn to dial what? 911. Right, exactly. Okay.
All the work we do in public health is about partnering and working with our communities. It's so important that we work with our school partners, not only in health education, but in building that capacity to respond, to be better emergency responders, and also to be more resilient.
We're not just hoping that they hear this information and then someday when they're adults they have emergency kits. We're hoping that they're going to take this information home and so that their families will be more prepared.
So working with students that connect with teachers, connect with the parents and families is a great opportunity to take messages into the home, into the community, and strengthen the resiliency in the long term for our community.
Most health departments are doing activities that contribute to national health security. They're just not calling it that.
So the National Health Security Strategy is the umbrella that really defines what communities expect out of their public health agencies.
One of our local hospitals were concerned about special needs, an access and functional needs school in their district, that they were all going to come to the ER in case of an emergency. What this individual did was come to the coalition and say, we'd really like some assistance with this. We started planning, and we were able to find out that the school really didn't have any plans.
I received a call inviting Hartwickson School, which is part of Granite School District, to participate in an exercise. We had just built a brand new building. It's 2 stories, so for our parents, our staff, how do you get kids out of a 2nd-story building, those kind of things if necessary. So it just sounded like an opportunity for my staff to go learn what resources were out there.
Not only did we help the school provide plans, we were able to assist them in getting food and water to shelter in place. We were also able to get them IDs that had pictures on it, because a lot of the kids are not verbal in the school, they're very autistic.
This really provided a lot of information to us to know that there are community resources to help us with our students.
The community expects that public health, working with all of its partners in the community, are working together to address that and make the community more resilient.
Public Health Reserve Corps is a mix of medical volunteers, doctors, nurses, and support volunteers, people from other walks of life who just want to help. And they're both really important. It's a balancing act for us. And their main goal is to help us in a disaster. We want to help further the public health mission. And they do that by going to places like food banks, foot care clinics, and places where homeless and at-risk people congregate for other services, for the services they offer.
One of the things about the National Health Security Strategy is it's not just government doing the response. It's not just government's ability to manage the consequences of a large-scale disaster. It's about the community coming together.
We saw the nurses today. They don't just sit on their chairs and wait. They go out and walk around, talk to people, make connections, bring people over and talk to them about their health. And so I think they, like us, see that as helping the community get stronger. We just want to make sure that we have the people that we'll need when it happens.
And I think when we think about the National Health Security Strategy, it's all of those things. It's bringing in the different sectors of the community. It's not just government doing it on them alone, and that we're doing it every day, not just when the big one happens.
These are just a few examples of how local health departments are improving the health security of their communities. How many of you participate in activities just like these every single day? What will you do tomorrow to advance the health security of your community?